Not long ago, small cell lung cancer was considered the forgotten cancer, and treatment was generally chemotherapy and radiation. But now there is a new treatment that is showing great promise. Joining us today with stories of hope and how this new medical advancement is saving lives is Maida Maggiamelli, who was diagnosed with small cell lung cancer back in 2018, and Dr. Jacob Sands. Dr. Sands, first question for you. What is the difference between small cell lung cancer and non-small cell lung cancer?
Well, historically, it was the pathologist looking under the microscope and on a cancer on a slide, and the smaller cells were small cell lung cancer, and the larger cells were non-small cell lung cancer. Now, small cell lung cancer tends to be a more aggressive type of lung cancer. It's about 13 to 15% of individuals with lung cancer that have small cell lung cancer.
And can you tell us about this new breakthrough in treatment and how it's going to make a difference for patients?
So the new breakthrough is a drug called a T-cell engager, or a class of drugs, from a class of drugs called T-cell engagers. These are drugs that bind the T-cells, which are immune cells, and bind the cancer cells and brings them together. And it's kind of an introduction of the cancer cells to the immune system that then helps create this immune response. That immune response can be ongoing, and I've seen people have years of disease control with this class of drugs. So it's exciting to see something that after the initial treatment, when there's progression of small cell lung cancer, that's when things get the most challenging. And to see something work for years in that space is very exciting.
And Maida, please tell us your story from your perspective as a patient. How important is this research?
Oh, this research is everything, Claudia. As you said, I was diagnosed in 2018, which makes August 5th my 6-year cancerversary. I was diagnosed with extensive small cell, which means there was metastases, and that is a spreading of the cancer outside of the lung. After I had chemotherapy and radiation, because immunotherapy hadn't been approved yet for my cancer, I had the cancer in my liver completely disappear, and the cancer tumor in my lung has shrunk appreciably and stayed there, which puts me in remission, meaning the cancer is stable. The fact that there's always a chance my cancer will grow again, knowing that there's another therapy out there available, is amazing and makes me feel very hopeful. I think it's important for people to know that, yes, I did smoke. And a couple days, I'll repeat, after quitting, I started having an incessant cough. If my primary care doctor, who knew I was a smoker, had sent me for lung cancer screening, which is a simple low-dose, no needles, no pain, you keep your clothes on. If he had done that earlier, they probably would have caught my cancer earlier. So I urge everyone out there who's still smoking or a former smoker to ask their doctor if they qualify. Because if they qualify for a low-dose CT scan, most insurance pays for it.
Yeah, it's one thing to ask people to stop smoking, and the second has to be an important follow-up right away with your doctor. Dr. Sands, which patients do you suggest small cell lung cancer should talk to about their doctors about this new research and this treatment? Who is it best suited for?
Well, anybody with lung cancer should talk to their doctors about what's available in a time, or I'd say all cancers. You want to talk about what are the available treatments, what are the new updates. As a lung cancer specialist, I'll say also seeing a specialist to know what the landscape is. That can be whether they qualify for this drug currently available, which many oncologists will be able to answer in the community as well. But on top of that, knowing what are the different trials that are going on now? What are the potential future drugs that you can get available today in clinical trials? And not every patient has a clinical trial that's right for them, but every individual needs to be evaluated individually to see, is there a trial that's the best option for them or not, and to at least know what options there are. And if getting treated on the standard of care, which there now is this new drug in the class of T-cell engagers, that's approved to be done anywhere across the country at this point.
And finally, where can we go for more information?
Claudia, I would encourage people to go to lcfamerica.com. That's the Lung Cancer Foundation of America. Fantastic resource for getting some questions answered and finding out the right questions to ask your oncologist.
Maida?